Good morning, everyone. Welcome to the August Health Innovation Community Partnership meeting. We're going to get started in just one moment. So we're inviting people in the meeting room with us to grab some coffee, grab some breakfast. For those of you joining us via Zoom, we invite you to do the same wherever you are. And we'll get started in just one moment. All right, we are going to go ahead and get started. So, thank you again for joining us. My name is Heather Hayes. I work for the Wellness Center and the Los Angeles General Medical Center Foundation. We're delighted to serve as the backbone organization for the Health Innovation Community Partnership. We are celebrating our 89th meeting today, which means next month will be 90, which is very exciting. But to go ahead and kick us off, as a reminder, we are, oops, I have to do this. Aha. Yes, as a reminder, these meetings are recorded and will be available on our website in about a week's time, pardon me. We do want our meetings to be highly interactive. We invite people in the meeting room with us to join us in conversation with our speakers and presenters. For those in the Zoom meeting, we will happily take your questions either in the chat or by raising your hand. And of course, our meeting is interpreted in Spanish. So please, everyone, select the globe at the bottom of your Zoom link to join the meeting in the language of your choice. Let's take a quick look at our agenda ahead. So today we will, as always, have an update from our Los Angeles General Medical Center. We're also going to have a community health update from Dr. Karla Gonzalez. Then we'll have a lovely presentation on supporting our immigrant families. And then we are very delighted to welcome representatives from the Los Angeles Police Department and the Los Angeles Sheriff's Department to share with us some of the way that they are working with the immigration enforcement issues in our community, but really to invite your questions. So please bring those questions forward for our representatives from the Police Department and the Sheriff's Department so that we can hear from them in response to what you most want to know. And of course, we'll conclude as always with partner announcements. Before we begin, I'll go ahead and read aloud our guiding principles for the Health Innovation Community Partnership. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person or organization or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I'm very excited to welcome our Chief Nursing Officer from Los Angeles General Medical Center, Dr. Nancy Blake, will join us to kick off the updates from the LA General Medical Center. Welcome, Nancy.
Thank you very much. So I am going to advance my slides. Oh. So am I supposed to speak to this as well? National Breastfeeding Month, am I supposed to speak to this? Because I was asked to speak specifically about magnet. I can speak to it. I'll jump in. So we are a baby-friendly hospital. What does that mean? That means we encourage breastfeeding. We don't accept donations of formula from formula companies. And we do our best to help our new moms and our patients that we serve in the clinics to help them be successful in breastfeeding. As an employer, we also have lactation rooms, and we have lactation rooms for patients and families to use as well. And there's a lot of research that shows that breastfed babies have a lower risk of illness, low numbers of sepsis, a lower numbers of SIDS or sudden infant death syndrome, and chronic conditions. So we are encouraged to really get them to breastfeed when they can't. We do have formula to supplement because some people are unsuccessful at that, but we do our best. We also have lactation certified nurses. They go through a certification. We encourage skin to skin contact, which helps with baby bonding for our babies that are newly born. And we work very closely with the families to make sure that we're responsive to any cultural needs that they have, and that we provide family-centered care. So there will be, for this month, there will be some booths out in the courtyard. We have some press release, and we're doing some additional staff education, and we're doing community outreach. So we do what we can to support this. And like I said, wherever possible, we work with our patients and families when they're unsuccessful at breastfeeding to make sure that they can supplement to make sure that the baby gets the food that they need. So how's that for filling in? So I don't know if our magnet slides are in here. Oh, I'm going backwards. That's why. So a few months back, Rhea came to talk about what Magnet was. We were on the Magnet journey. We've been on the Magnet journey for about 7 years here. Magnet is a stamp of nursing excellence, but it's not just about nursing. It's about the interprofessional care working together to have positive patient outcomes, which means lower risk of infections, lower risk of surgical site infections, lower risk of falls with injury. And as part of the magnet application, you have to compare yourself to the rest of the country. And if the unit's 5 out of 8 quarters, so over 2 years period of time, the majority of the time they're better than the country, you can become magnet along with a lot of other stories. We put about 120 to 150 stories together about things that we identified as a problem, the multi-disciplinary group working together, and then the outcomes post-intervention, which we look at 3 different data points. I'm happy to say that we got a call from the Magnet Commission. We had a site visit in May. We got a call from the Magnet Commission that we are magnet designated. We were the 5th county hospital in the country out of 6,000. And we're the only one in the state. So the closest one is Lyndon B. Johnson in Texas. There's one Harborview up in Washington. Wyoming, Cheyenne, Wyoming, which is actually run by University of Colorado. So don't ask me why Wyoming and Colorado got together. And then the last one is in Ohio, Metro Health in Ohio. So I'm thrilled because there are a lot of for-profit hospitals and not-for-profit hospitals with a lot more resources than we have. And our team worked really hard to improve care, which shows that a safety net hospital can provide the best care. If you look at our geographic area, Keck is a magnet hospital, Children's Hospital, UCLA, Cedars, and Long Beach Memorial, and a couple of the Kaiser facilities. But I'm really excited for our staff and proudly wear my magnet pin to show that we are a hospital that provides excellent care and really does live the mission of world-class care for all. There's a couple more slides. Oh, I'm going backwards again. You're gonna have to get me away. So this is when we really amped up our journey, was in July of 2021. We started shared governance, which is really working with the staff to do a lot of decision making from the bottom up. So frontline staff could make decisions. Administration doesn't need to make all the decisions, to get them to work together and really drive care and also provide good retention. In June of 2024, well, actually in October of 2024, we started a transition to practice program, which is helping the students transition from work from school to the work environment. There's a lot of turnover when people don't feel like they're trained appropriately. So we put our transition to practice program together. We hired over 600 nurses. It's Friday. In the last 2.5 years, almost 3 years. And we have a 93% retention rate, which means we're not losing staff to other facilities at this point in time. In March, we got in June we submitted our documents. In September we were notified they needed a few additional documents. We actually submitted those in January of this year, and then we actually had a site visit in May, the week after Nurses Week. The appraisers were 4 appraisers from large academic medical centers. They were extremely impressed that no matter who they talked to the union, they talked to the nurses, they talked to physicians, and they talked to all the ancillary staff, respiratory, physical therapy. Everyone could speak to the mission of the organization is the reason they were here. And they could speak to a culture that was really more employee focused as well. So we're very excited to say we got that call. We can proudly display the Magnet logo that's up there on the right. And then we start the clock for 4 years from now, and we have to submit our next document. Let me make sure I'm going in the right direction. So this is a picture we took last Tuesday. We had a big party in this room and the room next door, and staff were actually able to be on the call when the chair of the Magnet Commission made the call, and the chair of the Magnet Commission is actually the CNO at Cedars, who also sits on the hospital advisory council for the board. And we had 3 exemplars that showed that we were better than the rest of the country at 100%. Those were falls in the outpatient, burns in any of our procedure areas, and we had 8 procedure areas that we submitted, and that patients didn't have to go to higher level of care after having a procedure. So those were 3 exemplars that we had. Like I said, we're the first county hospital in the state, and we're the 5th county hospital to become Magnet. There are some state hospitals. UCLA is one, UCI, UCSD, UCSF. So there are several state hospitals, but no county hospitals in the state of California. So very excited, very proud. The staff have worked very hard to get here. And I'll entertain any questions.
Do we have any questions for Nancy about the fabulous Magnet designation that we're all so excited about, of course? Any and other elements related to the LA General Medical Center? Sounds like not at this time. Anything online? All right. Thank you so much, Nancy. I also did want to invite up to the podium the new COO of the hospital, Marco Torres. This was by invitation of our co-design committee that helps plan these agendas. They really wanted to invite you up to, do a quick introduction and maybe speak about kind of your enthusiasm about joining us here at LA General and any vision you have for how you're planning to support the campus going forward.
Good morning, everyone, and buenos días todos. My name is Marco Torres, and I love the way you said my name and rolled the R's. That's really good. My name is, again, I'm the new CEO for
Soy
LA
el
General,
nuevo
and LA General is not just another hospital.
director
It
de,
is the
opera-
first
de
county to
operaciones.
receive Magnet,
No
but
fuimos el
we
primer
also
condado
are
en
the
recibir
largest
Magnet.
academic hospital in
También
the country.
somos el
And
hospital
besides that,
académicamente
it's
hablando en el
also
país, y
home.
además
Home
de,
to me
de
because I
eso,
grew up in the
es un hogar
neighborhood,
para nosotros
live
porque
about 10
yo,
minutes away.
yo
And
crecí
just to be
ahí
back in
10
that leadership
minutos a mi
role
casa.
to help the team
Anteriormente
continue to
había
carry
un
the workload
liderazgo
that they've
que
already
llevaba a cabo todo el
started and
trabajo
just doing a lot
que
of great stuff with
inició hace
access,
tiempo,
quality
y
care, patient
todo era
experience.
relacionado con la
It
experiencia de la
means
calidad
a
del
lot to me
servicio,
personally.
calidad de
So I'm
atención a
just
los
very happy to be
pacientes,
here.
y estoy
And
muy feliz de
anything I
estar
can do to
aquí.
help, let me
Lo
know.
que
My
sea que
door's always
pueda
open. My
hacer por
vision is that we
ustedes,
continue the work that's been
estoy aquí
doing,
abierto
that
para
we've been
ustedes.
doing,
Mi
and
trabajo
then
es
also
seguir
continue
aquí haciendo el
to
trabajo que
grow in
hemos
the
estado
area of
haciendo
patient
y
care, quality
crecer
care.
en
Thank
la
you so much.
calidad
Mucho gusto.
de la
Gracias.
atención al paciente. Mucho gusto.
Does anyone have any
Gracias.
questions?
Preguntas?
¿Alguien tiene?
Well, that means thank you. Thank you for not asking questions now. I'm still learning. I'm still learning.
Well, we're very grateful for your presence here today, Marco, and know that this wonderful medical center is in excellent hands with the leadership team that's here at LA General. With that, we are going to move on to our community health update by another member of the Los Angeles General leadership community and also another local resident who's returned to do service here at LA General, Dr. Karla Gonzalez.
Thank you, Heather, and thank you everybody for being here. And I'm so excited to meet you, Marco. Welcome. So I am going to talk a little bit today about getting kids ready to go back to school. And this is a topic that I get asked about all of the time. And I want to start by saying that it is a topic that is evolving. We are still learning. We're learning about the world of technology and how kids are using it and how our young children are both benefiting and maybe there's some like adverse effects as well. So we're learning ourselves. And so if I say that there's not a hard, fast rule, just know that it is something that we are still learning ourselves. But I'm going to give you today some of the tips that we give to parents and caretakers as to how we approach the subject with our little ones and young people. I'm so sorry. Okay. So first thing I'll start off with is I'm not going to tell you it's an hour, it's 30 minutes, it's 2 hours. Okay, it's going to be a conversation, and I will say that each child is different. Okay, we know that we can't get rid of technology altogether. We need it. We need it as patients. You know, we need it to log into our medical records. We need it to pay our bills. And we're learning and we're catching up, right? I feel like my mom now, I remember when my mom's like, that's too much technology. I say that about the kids now. They know a lot more technology than we do now. And some of it is meant to make lives easier. But this is where we come in and kind of think about that balance. And then I'm going to use some of the information today from the American Academy of Pediatrics, which really tells us to go one step beyond and think about the quality and not just the quantity of the time that kids are spending on devices. So some of the things that we know are screen time may be having an effect with, and I'll call this a multifactorial problem. These are multifactorial problems, meaning that it's not all screen time. It's a lot of things going on in the world today. You know, it's the diet, it's the physical activity, it's the mood and the depression, anxiety that kids may or may not be experiencing. So things like sleep problems, a lot of things can affect sleep problems, but we know that this is one of the things that not only affects kids, but also affects adults when it comes to a lot of screen time. Grades can be affected. Reading, we used to be readers. We used to actually open up a book and read. But there's so many people tell me now, I actually use my tablet to read. This is how I read now. I cheat and I actually listen to my books now. So I'm using that technology in a different way, right? So reading less books, okay? How are we going to get that? How are we going to get the kids to read those classic books that we all know and love and that are so important in our history? And we're not actually opening up a book. The physical activity, this is a big one. I'm going to talk a lot about this one today as much as I can, because I think that physical activity with kids is something that we've seen decreasing for a long time. And then the pandemic may have made this problem a little bit worse. Problems with weight and mood problems, right? Mood problems is something that is very interesting as kids get into the adolescent years. Mood is something that we think about adults and depression and anxiety, but the mood changes in kids present a little bit different. They actually can present with sleep issues. So mood is something that has to be on our radar. And then, of course, how kids are feeling about themselves. What are they feeling about their body image? What is the image that they portray out there? It used to be that we were a lot less, I would say, conscious because our faces and our bodies and the way we portray ourselves wasn't put out there, right, in social media the way it is today. But there's a lot of things that are out there and kids need to think about, right? How are they branding themselves? So this is something that we really can teach them some tools about the future as well. The fear of missing out. They're looking at all their friends, maybe going different places, doing different things. It may or may not even be true. So this is another thing about like social media, at least, right? Is what is out there in terms of of accuracy, what is truth and what is not truth. And then just learning that, ways that we all adapted to learning how to relax. Okay, we used to go out and exercise. We played all day and came back late at night, right? And we did different things to relax. So how are kids doing that today? How are they learning how to self-regulate today? Okay, so there are some really nice resources. I added actually here is some strategies. I'll have some websites come up about how to actually develop a plan. But this is, if you take anything away today, this is the one message I want you to take away. If you are the caretaker of kids, if you are working with kids, please be gentle on yourselves. We are all navigating this. It is not easy. I can tell you that I think my own 11-year-old spends way too much time on her phone or tablet. Okay, so I am telling you that it is something that is difficult. So if you're feeling like, this is a challenge for me, it's okay. It's hard, and we're learning together, and little steps and little conversations will help a lot. Okay, so again, why is the child using the device that they're using? Is it for homework? Is it for entertainment? Is it for learning a new hobby? Okay, so sometimes you can't. I actually use YouTube all the time to learn how to do new things. You can pretty much find out how to do anything on YouTube. Or are they connecting with their families and peers and friends on social media? So one of the things that you can think about is when kids are using these devices. Okay, when is it that they're most primarily on their devices? So one thing is, maybe you don't want to say, oh, we're going to limit screen time to an hour, but maybe you want to say, okay, maybe we're not going to use it during breakfast when we're all eating together, or maybe we're not going to use it at night right before we go to bed, or maybe if you're asleep, and the tablet shouldn't be in the room. Okay, we'll remove it because this is sleep, because we're honoring the sleep activity that you need to be doing. Or maybe we're only doing this after we've had some level of physical activity, right? So you guys know this. You guys are parents. You know how we like kind of negotiate with kids. This is part of that magic, right? This is part of that secret sauce of being a parent. And then thinking about like that balance, right? Because if you tell a kid there's going to be no screen time, we all know, us also as parents, that what we're going to get is more screen time. All right. Okay. So we as parents have to be really, really nosy. And this is hard. As kids get older, they're very private about things. I now, as a mother of an 11-year-old, I get one-word answers if I'm lucky. I have to pull the answers out. I have to be careful with my questions and how I ask them so that I can make sure that I get more than just fine. How was your day? Fine. Okay, I get that. So this is where we're asking like, hey, what is that? What are you doing on your tablet today? Like, that could be part of the agreement. I'm letting you borrow a tablet. I need to see everything that's on there, and it's for safety. We're going to talk a little bit about safety. Advertising. What are we telling kids to get? The latest thing that I was asked for was something called a labubu. I don't know if you guys know about the labubu. So that's like the big craze out there, okay, labubu. And then last year it was, I need a mask. I need these like beauty masks for my face, right? So some of the things can be like more or less harmless, but also like what kinds of food advertisements are out there, right? Are they getting an overabundance of a certain type of maybe product that they're selling that maybe may not have the right consequences. So this doesn't mean that kids are going to not see these things. They are. They're going to talk about them. They're going to see them with their friends. But again, these are those conversations of like, well, what do we really need? What do we really need to purchase? What are we going to consume? And how are we going to, in our minds, begin to filter out the noise, filter out the things that maybe we need to make decisions about. This is a high quality product. I think I do really need this. And maybe this is just something that somebody's trying to make money off of, right? So those are the conversations. So again, we're noticing a theme. There's a lot more conversations happening and conversations about big things instead of putting like these hard, fast rules out. Of course, know who your child is interacting with. You know, one of the rules that I do have is I just need to know who you're interacting with on your tablet. I need to know their names. I need to know who they are. And we need to kind of like know them physically, right? I need to know that they're a friend, that somebody that I've met before. And then, of course, you know, this is where I think if we see something that's really positive on the internet, maybe some words of inspiration, there's actually times when I've seen things on the internet and I actually send them to my daughter. Oh, this is a great poem. Oh, this is a great inspirational thought. Hey, this is a journal that I've read, maybe a little bit too high for her level, but hey, look at this. This is something that I've read. Is this something that you've come across, right? Drug use or something that I've come across, and it's a conversation starter. Hey, this came across my feed. What do you think about it? So these are, again, conversations that we can have. Okay, so this is, I cheat a lot, right? When it comes to being a parent. So one of the things that I did is there was this device that had like it's like a VR headset. And we needed to do more physical activity. So we need to add more physical activity. So I went to somebody's house. They had the VR headset, and I could see that the kid was sweating. They were doing like this activity that looked like a gorilla. They looked like gorillas, and they were moving around and they were jumping. And then I said, well, this is some sort of physical activity. So I said, okay, maybe we can incorporate this. So can you do that? Is there a chance to use, you know, a video to do some sort of physical activity? We started doing yoga on our tablets. So that's one of the things my daughter and I do together now. We use our tablet, but we're using it in a different sort of way. You know, are we listening to some music? Are we learning some new form of art? And then this is hard, again, have grace with yourselves, is how much time are we spending on devices as well, you know, with that, you know, and maybe missing out on some of the more quality, essential time that we need with family and friends in, you know, face to face. And then, of course, maturity levels. So there's very, very little kids, you know, and then we'll see the content of what they're learning. We know that when kids are very little, between, you know, before the age of 6 and before the age of 2, there's some things that are happening in the brain that really can benefit from limited screen time. I'm not putting in hours time on there, like a time limit, but we do know that that those parts of the brain are developing in ways that they do need to be more of like read to with a book. They do need more conversations happening so that they could develop the language skills. And then also so that they could read the cues of how we socialize together. So this is another key piece, right? Like everybody that I come across, all the parents will say, well, my kid doesn't talk to anybody anymore. You know, they're in their room. And that is something that we see, right? So how do we socialize with each other? And how do we get like those little lessons for them? Like it's time to, you know, walk into a room, say good morning, say hello, and you know, not develop these adults that maybe are going to have some difficulty with that socializing. Emotions are hard. Kids are not going to tell you how they're feeling, right? So these are some key questions. You know, sometimes I ask, the question is not how are you doing today? Sometimes I ask like, hey, what kind of chisme do you have for me today? What kind of gossip do you have for me today? You know, and I get more answers from that. So, right, that springs into like, okay, how are we feeling? How was today's? Sometimes I ask, who got in trouble? Or who actually did really well today? Did somebody like really do something amazing, you know, that maybe we want to mirror? And then asking, and then just staying in general, I think just consistent, right? We're sending messages about screen time and having everybody in the family be on the same page. Be on the same page with, you know, and God bless grandparents. God bless grandparents. I will be hopefully a great grandparent someday, and I will spoil my grandchildren rotten. But grandparents also knowing the rules of what we're doing and trying to enforce some of those, trying to enforce some of those guidelines. So these are the resources that I mentioned. These are both in English and Spanish. Okay, so you can actually begin to develop your own plan with your children. And don't worry if you don't get this done all in one sitting. It's actually meant to inspire conversations and to get us thinking about what kinds of messages are we going to send about screen time with our children. It's not necessarily meant as like it's a hard, fast contract, but really to inspire us to just even start broaching the subject. Okay, and then I really like this website, the 5 C's of media use, which focuses on where is the child right now, what is the content, how can we, how does this help us regulate ourselves, regulate our emotions, and then crowding out, right? Like kind of reaching out and learning more about what can be helpful out there in the internet, and then communication. So these are some really nice websites. And then the good and the bad of social media, because as we mentioned in the beginning, we are all going to have to, it's here, it's not going anywhere. We need to learn how to regulate, as well ourselves. And one of the guidelines that I actually just even started with my child is like, there's a lot of stuff out on the internet that may not be truthful. So one of the not rules that we have, but one of the guidelines that we have is we're not going to send anybody or forward anything that we feel, we don't have the answer to. If we don't know if it's truthful, if we don't know that it's fact, we're not going to be part of the people who are spreading the false information. So this is the reference that I used. Again, I'm using the American Academy of Pediatrics as my guideline. We will learn more. The story will evolve. I know that by next year, we'll have more information and more data. So hopefully I can come back and give an update. Thank you.
Thank you, Karla. So do we have questions for Karla? Any questions or comments? I see a question in the audience.
Good morning. My name is Vivian Escalante. And the question I have is, I didn't see actually anything with regards to how when the kids are very young, they had play dates, but as they get maybe into middle school, is there any means of also having parents meet together with their children's best friends to make sure that they are also aligned? So it's curious to know how you're reaching out to the parents, parents to parents, and other educational institutes. Thank you.
I think that these things, that this is actually, I think it's a great question. And I think it's a larger question than just related to screen time, because I do believe that there's, children that your children will gravitate toward. And I think that the balance here is that not every friend that they come across is a friend that you're going to love. And not every parent that they have is going to be a parent that you love, right? But I think that this is an important conversation about boundaries. And if they're great friends and they really jive together, and we have some of those, we actually include our parents, together. So we actually have gone on trips together with some of the families. We may not be able to have that amount of time together, be able to have that benefit. But I do think that it's really important to know not just a parent, but who are the caretakers of this other child, and how do we interact in ways that are appropriate. Sleepovers, right? Remember, sleepovers were a thing, or they are a thing. And there was a time in my life when there was absolutely that was not a thing that we did. We did not sleep over anybody's house. And so those I think are those boundaries, right, that we set. And so your question is very valid. I think that those conversations with the parents and with the caretakers are really important. I like the idea of combined play dates. I think those are very telling. And I think that when there's differences, and there will be, we have to like start socializing the children to dealing with people that are different and may not necessarily have the same views that we have, and or maybe just challenges that kids will have, right? Kids that other kids will have that maybe our kids don't have, or our kids have challenges that other kids don't have. And that's where we start teaching about differences, and how to learn from them and how to interact with those differences.
Do we have other comments or questions?
Hi, this is
Great.
Ari.
Thank you.
Oh,
Go ahead.
go ahead. Somebody else.
All right, go ahead.
Hey, Ari.
Hi. Yeah, I just wanted to follow up on that one point, and I appreciate the presentation. I found that volunteering with the school and with the class is very helpful in meeting the other families, and really creating a class group. We have our own WhatsApp group for the classroom, and so those are things of modern technology. Speaking of, that help develop that network and get to know the other families. But just like in your presentation where you said, don't tell me what happened at school, it's more about the achievement. It's also volunteering is a different way of engaging the other families. And what you're really doing is finding out what's up, But thank you for your presentation.
Ari, that is so important, and thank you for reminding me about that. The volunteering is key. I know that at the wellness center, we've actually brought our children to volunteer at the toy giveaway that we have in December. And there's so many different volunteer opportunities, and we've done some of those. I really think that is a great way to learn about other kids and their parents, and also just to get them off of that, routine, whatever that routine might be for them. To get out there and volunteer. I think that is so important. And volunteering with parents. There's another thing that I've identified is that you learn that is your community, and you create lasting friends sometimes in those parent and caretaker groups. So we start learning who can pick so and so up. There's been times that I know that we actually have families that will say, hey, can you pick up so and so today? We have a secret code. They'll know that you're going to pick them up, or we'll even tell the kids right ahead of time on their phones, because they have phones now. So and so's parents are picking you up, and I'm giving you permission for that. So it does become part of our support group, and it's nice that kids can actually learn what adults and what family members and caretakers are safe people to be around.
Hi, thank you. I'm in the midst of this battle right now. I have a middle school child, right? And I think my question initially already kind of touched into it. I think this presentation with the schools education is huge, right? The clinical term I tell my son, it's called social retardation, because you could find these middle school kids with their devices sitting in a room. None of them are talking to each other, and they're looking at their devices. They've lost the ability to have social interaction, right? My son had electives during school. I think one of the most important programs that would be good for the kids is I insisted on theater to learn self-expression, all right? Some of those things aren't understood by the schools. In fact, the schools have taken away all books. I grew up having a locker for the books. They have no lockers anymore. I think we need to get back to tradition, help bring back school books and less device time, because my son, 7 hours at school on a device, and then to go home to be on the device more for homework. The schools, maybe they already invested and got the iPads. We have to reverse that and get back to some of the tradition, and maybe limit the technology, especially at the schools, because we as parents are busy. We take our kids to the school. We don't always have the opportunity for homeschooling, right? So I think that plays a big part, the education system and how we get them to be a part of this village, right, with the family.
Yeah,
Appreciate it.
I think that we are always learning to creative ways to remain socialized and to, this is where we have to mimic those social interactions that are healthy. And I think you're right. That's the complaint that I hear. They're always on their tablet. They don't interact with anybody. They don't say anything. And so some of this is also that, like, finding those unique opportunities. Last night we went to a yoga class at Las Fotos Project on Cesar Chavez, and so that is actually a center. They do a lot of photography with the kids, and so my daughter has actually done that, and photography, right, and old art that has evolved a lot in terms of technology, but there are some elements that are still very valuable for people to know. So she's done that, but we had the nice opportunity of having yoga together in a room full of people who identify as female, and we just had like a fantastic experience. The kids loved the two 11-year-olds, they loved it. And so it was nice to really be away and just have some time together, some interaction together, even though maybe it was like quiet time because there wasn't a lot of conversation, but there was a sense of this is how one way that we can regulate ourselves and regulate our emotions.
And we have a concurring comment in the chat from Jennifer Kuo. She says, I agree. As an arts and public health professional, arts-based activities help improve academic success, social connection, self-regulation, and overall health and well-being as a prevention method. Do we have other questions or comments? No. Well, thank you so much for bringing this clearly very prescient, timely topic to our attention. And I think the takeaway that I hear from all of you is there is hope. Work together, support each other, be kind to yourself, but build that plan. So thank you so much, Karla, for bringing that forward.
Heather.
All right. And next up, we are delighted to welcome Mayra Barragan O'Brien from Immigrants Rising to share with us some of what they are doing to support our immigrant families. I'm going to ask us to take down the slides because Mayra is going to direct the slides herself from share screen. So we can take down our slides and Mayra will share those with us. Thank you so much for joining us today, Mayra, and please take it away.
Hi, good morning. Can you hear me okay?
Yes, we can hear you fine.
Great. I just sent the request so that I can share my screen.
Yes. Okay, should be okay. We'll allow you to share your screen. Okay, I think it should be okay now. Good.
That's great. So first of all, thank you so much for the invitation. My apologies in advance as my presentation is only in English, but I'm hoping that I'm gonna go over everything so that the translation services are able to grasp everything that is on the slides. I'm gonna try to go over this quite fast because there's a lot of resources that I want to highlight. And I know that we have limited time, but briefly, just want to introduce myself. My name is Mayra Barragan O'Brien. I am the Mental Health Senior Manager at Immigrants Rising. And I also want to highlight that the reason why I am very passionate about serving the immigrant community is because I was myself fully undocumented for over 20 years. And so this work is not something that I just do, it's also something that I live every day. And so with that said, Immigrants Rising is an organization in which we envision a future where undocumented students and professionals can thrive regardless of their immigration status. And what we try to do is we try to empower undocumented people to achieve their educational and career goals through personal, institutional, and policy transformation. And I'm going to talk a little bit about how we do all of this work. And before going in there, I also want to share how Immigrants Rising defines undocumented and is anybody who entered without inspection or those who did enter with inspection but overstayed, those who have deferred action for childhood arrivals, or better known as DACA, or those who are currently in the on the process of adjusting their status or legalizing, and those who are vulnerable immigrants. And we also define a mixed status household as those family members that includes different immigration statuses. For example, someone who is a U.S. Child with undocumented parents. Again, we do have a lot of resources, and this is the goal, is persistence. Some of the things that I'm going to be sharing is that we provide community support through the Mental Health Connector and wellness support groups. We have so many different career and educational resources like the pre-law program, institution tool, higher education resources, scholarships, fellowships, all of that good stuff. I'm going to be sharing it in a little bit, and a ton of entrepreneurship resources. So what we try to do is we try to take this holistic approach in which we are seeing the person as they not only need one thing, there's so many things that affect their well-being. And so with that, I'm going to start off with my bread and butter, which is the mental health resources. I also forgot to mention that I am a licensed marriage and family therapist, and I had to accumulate my 3,000 clinical hours as an associate clinician by volunteering. Because in the state of California, you are able to get a professional license, even if you are fully undocumented, like I was. But there is still many barriers. And one of those barriers for those who are fully undocumented after they graduate with their master's degree is that we have to accumulate 3,000. Everybody has to accumulate those 3,000 hours. Those who are work authorized, they work a 40-hour-a-week job while they're, accumulating those hours, and they're getting paid for that. In my case and other people's cases, we have to volunteer them because the Board of Behavioral Sciences says that we can only be a W-2 employee or a volunteer. And so in my case, I had to volunteer those hours, 3,000 hours, which for someone who works full-time, that would be approximately 2 years of their labor. For me, it took me 4 years because I was volunteering part-time while having my business and finding creative ways to find that financial stability. Not even stability, but more of sustainability or survival. With that said, we do have the Mental Health Connector that connects California students in higher education with a mental health provider. These mental health providers have either lived experience like myself. They're currently work authorized, they're fully undocumented and fully licensed, or they have experience working with the undocumented community. These are completely free resources. For the Mental Health Connector, the students see their therapist for at least 28 sessions. So that's about 7 months that they're able to see a therapist without having to pay anything, without having insurance, or anything else. For the wellness support groups, these are also virtual, 1 hour a week for 6 consecutive weeks. About 10 to 12 people get together. They're all part of the undocumented community. They share with one another, they connect, they feel seen, they feel understood, they feel less alone. And they are also facilitated by a mental health provider. We also have other resources like directories, other free support groups, hotlines for different populations. So we were able to put this list together, and everybody can get access to this PowerPoint, so you can click on all of those resources that we have here. We also have a toolkit for those who are not ready maybe to engage with a therapist or to be in a group. Maybe they can do some exercises on their own. And this is a great tool to reduce stress and anxiety and many different situations that the community faces. With that said, I also want to highlight these three amazing career programs that were designed for the undocumented population. The Home is Here Leadership Program, it provides leadership experience and professional development for undocumented people across the country. And this provides a $7,000 stipend for each participant. And it's about a 6 to 8 month program, depending on the year. And they're engaged about 10 to 15 hours a week. And they learn entrepreneurship skills, leadership skills, so that they can take across their communities. The pre-law boot camp is for those who are undergraduate students and they're thinking about going to law school. And this boot camp also offers, can I say, to $5,000 and $10,000 stipends so that they can apply for grad school and cover some of those expenses, like the applications, like the study materials. And it's also a really cool program. And I'm very proud to say that I created the mental health career program. And this one is for those who are undocumented professionals. In my case, as I shared a little bit, where they graduated with the master's, they need to accumulate those 3,000 hours, and they are volunteering at a site. But with Immigrants Rising, we give them clinical training, professional development training, mentoring, supervision, and we also give them a stipend. So those who are in the first year program, they see 10 clients, and they spend about 15 hours as a part of the program, and they get a $14,000 stipend. And the second year see 15 clients, and they get a $20,000 stipend, and they also get training in EMDR. So for those who may be familiar with EMDR, it's a very specific training where therapists learn to provide their clinical skills for those who have experienced trauma. And I'm gonna skim through this to let you know that there are ways in which for Immigrants Rising, sharing is caring. So if you are an organization that have been thinking about how do I create a program like this, like a fellowship program where I'm able to give a fellowship or a stipend to program participants, we have guidelines for that, and we can also connect with you if you have the resources to provide this type of opportunities for the immigrant community. We have so many resources regarding accessing higher education. We have a quick guide, fellowship and scholarships. Now, mental health has been my bread and butter, but education has been the bread and butter for Immigrants Rising since it started in 2007. So anything that you want to know about going into higher education as an undocumented student, we have so many resources. The website is so rich with many different things, including the in-state tuition tool that tells you what is it that you need for you to get in-state tuition instead of paying as an international student. We have a list of scholarships and fellowships that we update every 3 months, and you can filter by your degree, your field of study, immigration status, minimum GPA, and it's a great way for folks to get that financial help in this at a national level. We also have the Undocu Digest, which is a newsletter for those who support undocumented students. And it's sent every other week with a lot of resources, the ones that I spoke, and many more. Make sure to connect with Hugo if you want to be added to this list, and add Madeline, who is the person who oversees the program. And lastly, I want to share again a lot of us don't know at one point that we can have a business regardless of our immigration status at a national level. So Immigrants Rising created the Immigrant Biz Hub, which is an entire website where it's so rich with information regarding how to become an independent contractor, what's the difference between an LLC, a sole proprietorship, corporation, what are your possibilities, what are the costs, things to think about, name of your business, a business plan. So there's so many resources, and it's super friendly for the eye, and it breaks it down into sections for you. So that way you don't get too overwhelmed with all the information that you might want to know about creating a business. We also provide a webinar series on income generation and other webinars to better your business. The most recent one that they had was about how to leverage AI for marketing purposes. So it is amazing for those who are looking into different income ways to get income. With that said, I know I have shared a lot. If you would like to stay connected with Immigrants Rising through social media, please follow them at on Instagram or TikTok at Immigrants Rising. We are in LinkedIn as well, and you can always visit the website. I am the expert of mental health, as I am the mental health senior manager, but you are welcome to reach out to any of my colleagues here. Danae is amazing, so knowledgeable with everything regarding entrepreneurship. Madeline is the interim director of higher education, anything regarding higher ed. And Rocio is an expert in career. She's overseeing the different career programs, and you can ask her any questions about that. And Laura oversees all of the programs. So again, you can always reach to any of the folks in this. We're here to help. We are here to share. And just a little more, that is not about, this is not one of our resources, but in case that you would like to know or you would like to share some of those policies that are being currently shared or some of them implemented, you can see them here. But we also linked the California Rapid Response Networks because of, it is important to know, especially with everything that's happening in our communities. And we also have immigrant rights and protection resources that you can share. And like I said, sharing is caring. So I'm hoping that some of these resources are helpful for you and your community members. And I'm always here to help answer any questions that you may have. I know I went a little fast over all of this, but like I said, two things. I want to be mindful of the time, and two, these slides are going to be shared with you. So I will stop sharing here. I welcome any questions, comments, concerns that you may have at this moment.
Thank you so much, Mayra. We really appreciate this rich set of resources that Immigrants Rising presents. Does anyone have a comment or a question? Is there anything in the online? Nope.
I see.
Oh, we do have a hand raised from Pam. Take it away, Pam.
Yes, good morning. I have a question, and I may have missed it in the slides, but does Immigrant Rising coordinate any type of income support for immigrant families in Los Angeles? For example, housing assistance, rental assistance, interim housing. I think I missed that if it was provided in your slides.
Thank you for that, Pam. Unfortunately, Immigrants Rising is not an organization that provides that type of support at this moment, but we are linked with other different organizations So we have a list of resources so that whenever somebody reaches out to us and asks about that type of resources, then we send them to those other organizations.
Okay, good to know. Thank you. I guess a second question is once a family member reaches out to Immigrants Rising, is there an organizer or a caseworker that they are assigned? Or is it more like independent, like the individual needs to follow up with your staff?
It would depend on the type of resources that they need. Immigrants Rising is not a mental health clinic, so we don't have caseworkers or social workers as a part of our staff, but we do have folks who, again, are very passionate about what we do and we follow through. So, for example, if somebody reaches out and meets the requirement to meet with a therapist, I or my colleague Nicole, who is a mental health manager of the programs, we connect them directly. We follow up. We make sure that there is a connection. And we also encourage the prospective client or the family who needs that support, let's say connecting with the therapist, to follow up with us and to follow up with our supervisors so that we are held accountable in case that we have not gotten one person that, at least to my knowledge, that has shared something like we were ignored or we were ghosted or I did meet the criteria, but nobody responded. Everybody's very good at answering those messages and connecting with folks.
Thank you. I just wanted to, get a better sense of how a person, follows through the services. And last question, because I know there might be other questions, is, the governor just removed, to my understanding, they removed Medi-Cal, right, or Medicaid access to immigrant undocumented residents. How does that affect Immigrant Rising providing the mental health services? And I guess if a resident, like for example, goes to a public hospital or a public agency and they are denied care, how is your organization working around that? Or is that still a conversation?
We've never used any type of insurance. We don't get any type of federal support. We get some grants, some private grants. We are currently working, for example, we recently got a grant from NorCal Kaiser to support NorCal folks. So if anybody knows about SoCal Kaiser who wants to provide us with grants so that we can continue to work with the community, that would be amazing. But what I can share is that we've never asked about this. The services that we provide are specifically for those who don't have health insurance and no means to pay out of pocket. So that is one of our screening questions. Do you have health insurance? No. And you're a student in California, we will connect you. At this moment, the applications are open and we are ready to connect 95 students by the end of this month, August. So if you know of any student in higher education in California who wants to get connected with a therapist, the application is open and they will, if they apply in the next week, they will for sure get connected with the therapist by the end of this month.
So wonderful. Thank you so much.
Yes, of course. I see one question about how hard it is to get accepted in the program. Each program has different criteria that you would have to meet to be a part of it. And if you apply and you meet the criteria, you will get in. Although it's very competitive, as a lot of people who don't meet the full criteria apply, it is a high likelihood that you will get accepted.
Thank you, Mayra. Do we have any additional comments or questions? All right. I think you've presented beautifully today. As mentioned, we will be sharing the presentation out with our HICP membership. It will also be available on our website in about a week's time. With this, we'll conclude this presentation. We're going to take a quick couple-minute break to let our interpreters stretch their legs and rest their voices, and then we'll come back with representatives from law enforcement to talk about local law enforcement's efforts. So we'll be back in about 5 minutes. Thank you so much. All right, we are going to go ahead and get started again. Welcome everyone again to the August Health Innovation Community Partnership meeting. I'm delighted to invite to the podium Anabel Martinez, the Justice Deputy for the Office of Supervisor Solis, who will introduce our next speakers.
Buenos dias. Good morning, everybody. My name is Anabel Martinez. I'm Supervisor Solis Justice Deputy as well as LGBTQ Advisor. It is my pleasure to introduce you all today to Deputy Chief Jeremy Hurtado from Los Angeles Police Department, as well as the captain from one of the captains from the East LA Station Sheriff Station, Captain Chris Kusayanagi. They're both here to talk about how law enforcement policies around immigration. So without further ado, I'll invite Chief Hurtado to this podium to talk a little bit about LAPD policies. And then we'll have Captain Kusayanagi also talk about LAC's policy, and then we'll open it up for questions for both of them.
Perfect. Thank you for having me and having us and be able to talk with everybody in a partnership, exactly what LAPD does or law enforcement in the state of California as it relates to immigration. I think right now it's a very important topic. Obviously, we've seen ICE and we've seen CBP in the city of Los Angeles. So there's a lot of questions pertains to what we do and why we do it, and what role does law enforcement have within the civil immigration. But since I wanted to start off, since 1979, Los Angeles Police Department has had a policy that we don't take any police action based on somebody's immigration status. So we're not going to stop anybody and ask them how they got to the United States. We're not going to ask them their immigration status because that's a civil code. Improper entry into the United States is a civil code. It's no different than asking somebody if they paid their taxes, right? That's just not in the law enforcement realm. Now, there is 2 occasions that law enforcement does have to arrest or take some sort of law enforcement action when it comes to immigration. And the first one is if there's a warrant. If we stop somebody unrelated to immigration, if we do a traffic stop or some sort of arrest, and the person has an arrest warrant that's been signed by a judge, we obey all warrants. So then that person would be arrested for that warrant, whatever it may be, immigration related. All warrants we have to arrest. And the second time is under Section 8, 1326 of the U.S. Code. And that's when somebody has committed a serious or violent felony against another person. They've been convicted, they've served time in prison for it, and they were deported out of the United States with an order not to return. And they return, then it becomes a felony. And that's the other time that we may arrest. And those are the only 2 times that law enforcement will take action. In 2018, the state of California then enacted SB 54, which basically said the same policy as LAPD's, that we will not take any enforcement action on someone for their immigration status. So LAPD, the city of Los Angeles, for 46 years has already had that policy because we truly understand the importance of vulnerable communities. We understand that they need to be our eyes and ears, and we need them in order to make the city safer. So we really take that stance that we're just here to make the city safe. Now, with that, there's been times where some federal agents have called the police for assistance. And the only time we'll help any other agency is if it's related to a crime. If somebody's attacking or trying to hurt another officer, whether it's federal, local, or state, we will respond. We respond to all police calls. So that if you've seen LAPD respond to calls from Border Patrol or ICE, and that's because they've requested a help call, or they've requested law enforcement agency to keep the peace. We will go there, but again, we're not there to arrest somebody for a civil status. We're just make sure that nobody's going to get hurt, and we keep the peace within the city of Los Angeles. And in short, that's pretty much all our policy. It's really actually that simple. So I think I have my partner, unless we can introduce him, or you want to go into the questions, or okay, and then we'll have him after Roger that. So that's LAPD's policy in a nutshell, and it's very simple. We don't participate in civil immigration. So if somebody is asking, they think that they cannot come to the police because their fear, they've been let's say they've been victimized and they're a victim of a crime, and they fear coming to the police or the police station, please let them know not to fear that. We're never going to ask them. But we also, at the stations, we fill out U visas and T visas for victims of crimes, right? And so last year we filled out 2,400 visas, U visas, for victims of crimes who are undocumented, and that gives them the right to stay into the United States until their court is done, and then they can apply for citizenship. So we filled out last year 2,400, which is more than any other city within the United States. So we're very supportive of all our communities, especially our vulnerable communities in the city of Los Angeles. Thank you.
And I'll have Captain Chris Kusayanagi come up to the stage. He's the captain from the East LA Sheriff Station.
All right, thank you and good morning. So not to reiterate everything that was just presented by the deputy chief, because he actually put everything out there, that, and the sheriff's department is almost virtually the same. Immigration status is something that we have never enforced. At least I've never done it in my entire career. I've been on the department for almost 30 years now, and that's never a question that's ever came out of my mouth. It's simply something that we at the sheriff's department and our partners at LAPD, that's not our job. We're here to enforce local laws, California penal codes, vehicle codes, that type of situation. I want to make it very clear, because I've been to many of our public or our community meetings, and we've used our partners, partner agencies, LAPD, SD1, all our different government agencies. We have a lot of meetings because this is a serious issue, and it has eroded some of the public trust in law enforcement, which is something that we've worked on very hard, and it's pretty discouraging for us to have to try to basically mend those fences again. So the one message, and I'll start with it and I'll also end with it, is never hesitate to call us, because our job is not there to find out what your immigration status is. Our job is always going to be public safety. Our job will always be to help as much as we can. And when it's appropriate, we will arrest for certain crimes, but not for an immigration status. The deputy chief went over the few circumstances where there may be something like a federal judicial warrant, but those aren't immigration status operations. As far as the sheriff's department, we don't go along with them if they're going to go do those type of operations. Most times we don't even find out that they're in our area until almost after the fact. Several times we have found out after the fact when things have turned a little bit messy, and then we get called to try to keep the peace. But like the deputy chief mentioned earlier, we also don't go there to try to. We're not cooperating in that sense. We're there to keep the peace. We're there to make sure everybody gets home safely. But again, that's something that sometimes becomes an issue, and we've had that misconception on a few occasions. In fact, we had one that was in LAPD's area where it was actually our undercover deputies that were conducting a search warrant or an arrest warrant, and unfortunately, everybody just believed it might be someone else. They literally thought it was ICE. So that's the other thing I wanted to touch on just for a second, only because it can become an issue where people are worried about, is it ICE or is it us? I'll just say for the sheriff's department, it's pretty clear. We actually did push out some public safety announcements on our social media platforms and through the news media. And it kind of goes over what uniforms we typically wear. Obviously, the one I'm wearing today is the most common one you'll see. But if we do have like a search warrant or an arrest warrant situation or operation going on, sometimes our our deputies do wear the outer vest, but it'll always say sheriff on the back. And we issued the pictures of them so everybody doesn't have any questions as to whether or not this is actually the accurate uniform that we're wearing. We will always have sheriff's department on it. And if you ever have a question, you can always call the local sheriff's department if that's in fact the jurisdiction that you happen to be in. And we can always try to deconflict to find out if somebody actually is in our area, if it's us. I've literally had a couple times where I've been called asking about something in our area. And I said, well, okay, tell me what location you're talking about. And when they described it, I go, well, tell me about who's standing out there. What are they wearing? And it sounds funny, but I literally had to tell them, you're talking about me. I'm standing out here right now with some of my, deputies. They just conducted an operation and I'm just debriefing with them. So I get it. It's very confusing sometimes. But the only thing I can always guarantee you is just call the station, call the local PD, call the, whoever it is, and we'll do our best to try to deconflict that situation, at least try to bring some peace to your mind if that's the question. I don't want to go over everything that was just mentioned because again, it's accurate. We aren't out there enforcing civil immigration laws. That's just simply not our job. We are there to protect the public, and I don't want anybody to ever hesitate calling us. So I'll say it again, only because it's extremely important that we have to maintain that relationship with our communities, because we need to have that relationship in order to do our job properly. Our job isn't to guess at what we're supposed to be doing. Part of it is taking the information from the community, and because if we're not serving the community, then we're not doing our job. So we will do everything we can to ensure that we're doing our job and making sure that the community feels safe to call us, because all the things that are going on around us is kind of eroding our relationship, and we really need to build that back. So that's why we're here doing these kind of meetings. I want to leave a lot of time for the questions, because the questions you have, I mean, that's what we're here for. We've got to try to answer those and try to bring a little bit of peace of mind to whoever has those types of worries or concerns or stress.
Thank you so much. I'm going to hand one of the microphones over to the deputy chief, and then we'll take some questions from the audience. I see we have two raised hands. I'm going to let Monica go first and then Pam go second.
Hi, thank you for coming, and I'm sorry I'm not there, but so let's be very, very honest, and I'm going to be very, very frank, especially with LAPD. It seems when I'm looking at what's happening when they're coming and doing raids, it seems that the police departments are supporting the raids or the ICE, that you guys are protecting them against the community. Even the way you stand, you always stand facing the community, not them. A lot of times, and what we're hearing and what we are very, very afraid of is that there's people pretending to be these individuals and taking women and taking children and doing all these things that, they're kidnapping people, the sex trafficking, all of that. And the perception, I understand what your policy is, but that's not what we're seeing. I think you have to be very, very clear the way you stand. And I've talked to other officials, especially about what's going on in LA with LAPD and what we've seen. And it always seems to be that they are there protecting them. I don't see anybody asking and verifying who these people are, because they do not tell the community when we're asking for a name and badge number, like we do. Like if I ask you, what is your name and badge? Or I ask the other person, what is their name and badge? You know, you will tell me. I've never had a problem with that. But these people that are coming in and kidnapping people and tearing people apart from their families and from the community, it's just very sad. And the trust is not there, and it's getting worse and worse for both LAPD and the sheriff's department. So something needs to be said how you interact. And I know what the law is, that if they call you, you have to come. But when you stand and you're standing protecting them, facing the community, that just tells us you're not there for us. That's all I have to say.
All right, so I'll speak specifically for the sheriff's department and actually even more specific about our East LA station. I'll refer back to, we did have an incident over in the city of Maywood. And there's actually two incidents that are next to each other. One was Maywood, one was Bell, which Bell is actually not in our area, but so we got the call. So to answer your question a little bit, and I apologize that this isn't going to probably give you clarity on everything, but sometimes we do get the calls from the federal agencies, so we are aware of who, at least that they are actually a federal agency. So the question about do we know, have we checked IDs? We're not going to check IDs out in the field very often, but on that particular occasion, I myself got the phone calls from some of our through our operations center who was in touch with the federal agencies. So we did have verification of who we were dealing with. And our main goal was to simply provide the public safety and quell the disturbance, at least as far as making sure that nobody was going to have any issues or anybody was going to be injured. That was our only mission in that one. I can see what you're saying. If it appears that we're, at least in that instance, that we are defending the federal agents or ICE agents and not the community. But at the same time, we have to acknowledge the fact that once we can confirm that it's a federal agency and they're asking for our help, we have to treat them like any other law enforcement agency. And if they're requesting our assistance because people are possibly getting aggressive towards them, and again, I'm not trying to pick sides on this. I'm not trying to defend their actions. I'm just simply saying this is the information that we're getting. We went there simply to make sure that everybody was able
So
to.
I understand that, but do you understand that when we're calling and we're saying somebody's being kidnapped again, and you talking about perception, right? We're not seeing like I think I would have more trust if you guys were facing them, and then you talking about IDs, like you're basically telling me that you know of every operation that's happening in your area,
Okay.
right?
Yeah. So let me finish real quick. Like I said, we don't know about every operation. I said on that particular incident, and let me be specific about that again. I'm talking about one particular incident that happened in our area because we haven't had many that happened in that type of fashion. We had that information because the phone calls were made through the proper channels, so we had that information. At the same time, just so you know, we were also on the phone with our local leaders from the city. So the idea that we're not having communication, we're 100% having communication in that incident with our local leaders and our federal agencies so that we knew exactly what's going on and we're communicating that information back to the community at the same time. I don't think to be honest, on that one, it's not going to probably fall in the same lines as what you're talking about because when we arrived at the location on that one, they were leaving. So we never had that kind of face off that you're talking about where there was ICE agents and then there was the community facing off. When we got there, they were leaving. So we didn't actually have that incident. So it's hard for me to, accurately describe what we would do in that exact situation. But I apologize. That scenario probably isn't answering your question properly, but I just brought it up for reference because it was the one incident that we actually had to deal with in our area.
I think the captain answered everything I would say, but sometimes there is information that we do know. And that's why when we get there, let's say they make a help call, and they said they're being taking rocks and bottles or people are attacking them, then we already know kind of what we're dealing with. And there's always more information than what you see on television. But that's why we're here. That's why we're here talking to everybody, explaining exactly what our role is when it comes to immigration. And we appreciate everybody's honest and candor because it's the truth. If somebody believes, they're gonna believe what they see. So we appreciate it, and that's why we're here to answer those questions and clarify it for you.
Thank you. I'll invite Pam to ask her question.
Thank you. And thank you for the Health Innovation Community Partnership and Supervisorial District 1 for coordinating this presentation. So important. I have a few questions, so I'm also happy to stagger. But I'll start with my first one, and this is to both LAPD and the Sheriff's Department. First question here, what type of trainings do LAPD and sheriffs undergo about changes to tenant rights laws? For example, the city of Los Angeles has a tenant anti-harassment ordinance, which the county has had since 2020. And it lists over 10 descriptions of harassment, including what penalties it would be if property owners or property management companies do them. This definition also includes when property owners threaten to call ICE on residents. What is your process to handling situations like that? And do your departments undergo ongoing trainings?
I'm not sure about LAPD. For us, it's a good question. I don't know that we have any updated, training on that particular topic specifically, but I would always defer back to some of our political leaders. Obviously, we have the supervisor districts, but not only that, but we actually have, and I'm probably certain that LAPD does too, just because we're larger. We have large departments. Is that we have bureaus and divisions that are specific to some of these things that you're talking about. Like we have a civil management bureau that handles like the levy crews, evictions. So they're a little bit more up to speed on property and renter rights. In fact, we have those liaisons, and I would always defer back to them if we got those kind of questions. Just anything that hits a specialty, we'll defer back to some of our units that have that specialty, so that we can have that conversation to see what are the next steps or the proper procedures that we can take in order to address those issues. So if that does come up, I would encourage people to call, whatever jurisdiction you're in, and then we'll follow up with them to see what we can do. I apologize, I don't have a specific answer to that because that's a little bit more of a specialty question, but we 100% would find those resources and try to come up with the most appropriate answer and response.
Yes, and I can answer for LAPD. So we do have consistent training, and I know the sheriff does too. We have roll call training pretty much every day, and in that roll call, we discuss current events, and some of those current events right now is obviously what we see with immigration. Not only that, but the chief just put out a notice for all the officers exactly how to communicate and what the tactics should be when we respond to calls like the kidnappings and people calling, whether it's ICE or it's the citizens calling for us to identify the people that are there. Specifically to request, the chief wants us to request for a supervisor for that agency, ask them for identification, and then from there we just go ahead and turn back to whoever is there and communicate with the people and let them know, well, yes, it is ICE and they do have the right to be here. They're acting within their scope of their duties. So that's part of the training. And another training, we have senior lead officers in every geographical division within the city in 21 geographical areas. And we're going to start a program where it's going to be, and in every area is going to have somebody that goes to training monthly with immigration laws and how we're going to respond. And that's going to start kicking off in September. Right now, I'm the immigration liaison, but I'm going to have basically 21 people that is going to assist me in every area in the city of Los Angeles for the whole 450 square miles is going to have a representative that they're going to be able to go to the station and ask them questions. LAPD just recently published its new frequently asked questions pamphlets in many different languages. Right now it's in English and Spanish, but we're going into many different languages, and that's available on lapdonline.org. On Spanish, if you go to Get Help and then hit Immigration, you'll be able to download those pamphlets where it has many frequently asked questions pertaining to immigration laws. And as part of what we do, what LAPD does for tenants' rights, that's more a CAO or city council question, where they can make laws for the city of Los Angeles that are municipal laws that will assist the citizens. The LAPD does not give legal advice. We just enforce the laws that exist.
Thank you,
Thank you
officers.
so much for that.
Like
Oh,
I said, I
I was-
had a few questions. I said it at the start. I just want to
Pam, if you would just give me one quick second. I was going to invite the deputy chief to come up to the front of the room so the people on Zoom could see you as well as hear you. Thank you so much.
Thank you.
And please go ahead, Pam. And then after your next question, we'll go to Ari.
Thank you. But I just want to, two more. That's it. So LA County unanimously passed the LA County Tenant Protection and Rent Stabilization Ordinance back in 2020. That's for the sheriffs. And we have LARSO and we have, so I wasn't asking about enacting protections. Those protections are already there. And they outsource, the county and the city outsource rapid response to local community-based partners and legal service providers on tenant rights. We are trained to interact with law enforcement. And I just want to share a couple of scenarios that I've seen recently. Whenever I've called the sheriffs to inform them of an illegal lockout, of a self-help eviction, and I provide officers the memorandum from the state attorney, John Bonta, about what is a self-help eviction, how should law enforcement respond, they tell me this is a civil matter. Then they ask me, as I'm on the call, give me your full name. Give me the vehicle that you are driving, Pamela. And when they arrive, they ask for my identification. This is a common thing that I see from LAPD and the sheriffs. Is this practice? Because we are told through State House delay that, we're just responding. We need a police report. And it is a very uptick of complaints that we're getting in our program, which again is an LA County program, where callers call us and say, our landlord is threatening to call ICE. So we want a police report that says that this is happening. But whenever police departments arrive, they refuse to give us that because they say, A, we didn't witness it. But then we see it as organizers. And yeah, it just seems like it's always a teaching moment for the officers that respond. And I just want to know, what is the protocol? How can we get to a point of a protocol? Or in the worst case of scenario, how can a civilian submit a complaint regarding officer conduct? Thank you. And those are all my questions.
Okay, so let me, I'm sorry.
No, go ahead, sir.
All right,
Please.
So let me hit up a couple things. There's several questions in there. First off, citizens complaints can be done at any time. They can come to any station, they can call. They can also, there's 1-800 numbers. You can go on to our website, lasd.org. There's a multitude of ways of filing a complaint, or even voicing a complaint, or if you just have a concern. I would actually highly recommend first calling the station and talking to the watch commander of the station, because I would say a vast majority of these issues can be resolved at that level. The watch commander, who's typically a lieutenant, sometimes it's a sergeant, but typically it's going to be a lieutenant, will have a little bit more knowledge and a little bit more resources at his or her fingertips, and we can deconflict some of these issues. The training component, yeah, I'll be frank, sometimes we don't get all the training that we need, or we don't have enough of these discussions. But if there's a problem that you're bringing up, I invite you to come to our station, or come down, to one of these meetings, and we can discuss it, and we can try to find some resolution to these things. That's why I attend most of these meetings in the community, is to try to find those resolutions, because again, it's a community effort. So if we're falling short on something, then absolutely, let's have a discussion and see what we can do to make some improvements in that realm. The easy answer, though, on most of these incidents is reach out, call the watch commander, and see what can be done from that level. Because I understand that sometimes the deputies aren't going to be equipped with all the information that they should have or need, but the watch commander will definitely lead you to a better resolution as to find some type of answer, or at least we can have a discussion about what's going on, and hopefully we can resolve the issue. I think I covered most of the questions.
Sorry, someone was having a little hard time hearing you. You're taller than I am, so I'm going to give you that microphone instead.
Okay.
You could use the hand.
And I wanted to also iterate that even though that let's say, I think the caller said the question was, why do, they're threatening to call ICE on them, right? And why don't we take action? Because it's not a penal code crime. Unfortunately, sometimes people do enact laws, right? But there's no remedy to them. For example, for us to arrest somebody on a threat, it has to be unequivocal, immediate, and has to be something that's harming to somebody. So that's a penal code crime that can be arrested, right? There's a couple elements more to that. But somebody threatening that they're going to call ICE is really not an arrestable crime. And that's kind of where there's some confusion comes there. Oh, the officers didn't do anything. They didn't take a report. I wouldn't take a report or arrest anybody for that too, because it also falls under the constitutional law. They can freedom of speech, right? Because it's not a threat of violence. No different than you break the law when you don't pay your taxes, but I can't arrest you. I can't arrest you for that too. So there's civil, and then there's penal code, and then they falls under misdemeanors and felonies. So there's sections to that. You not paying your taxes or you threatening to call ICE, that's unenforceable.
I think Ari, you're up.
Thanks.
Okay. Can you hear me okay?
Yes.
Okay, good. All right. Thank you so much. Again, thank you for joining our meeting at short notice, and it's definitely appreciated. There's always an opportunity to connect with the people in charge of certain topics. Now, in your presentation, you both mentioned that I do have two questions. I'll go ahead and ask them both. So one is, you mentioned, and I also heard other police chiefs talk about this, and that is where ICE will call your station and say, hey, we're going to do an action in your area. Number one, just to let you know, or we need backup, right? So the question about that is, at that point, do they state they have a warrant signed by a judge? And I want to qualify this question because in our community work, there's a red card that guides people to say there must be a warrant signed by a judge in order for them to effectuate that. And so if there is that, then we can understand. And number two, if there is that and you're standing there with ICE, could you not inform the people who are there, who are worried and who are feeling that this is a kidnapping, that there is a signed warrant by a judge? Because I think that they would understand that. So I have not heard from any authority that this level of sharing of information is happening with the federal agents and local police. So I want to have a clarification on that. First question.
Yeah.
Second question, if I may.
Can we do one at a time?
Sure, go ahead.
Yeah, thank you. If you don't mind. Yeah. So actually, absolutely, everything you're saying is true, but like what those red cards fail to put in there is the actual details, right? When do we need a warrant? You need a warrant when you're going to arrest a specific person for a crime, or you're going to search, for example, a house. So if they're doing, let's say, an operation in the street, they don't need a warrant. They have their legal right to be there. They're federal agents. LAPD, the sheriff's department, we cannot go over there and tell them, hey, you need to leave. You don't have a warrant. A warrant is if they're going to arrest a specific person. It's a Ramey warrant. Arrest a specific person for a crime, or they're going to search a house. Those are the only two times. And that's what those red cards forget. They don't detail those things. They can be in the street. They can stop people just like any other officer. You're not going to, if you get pulled over today speeding, you're not going to ask a police officer if he has a warrant. I don't think so. And it's the exact same thing for other law enforcement agencies. Does that answer your question?
So I understand that, but it seems like it's kind of a setup because they show up in scary costumes with the intention to just grab and go.
Right.
And so technically by scaring them, people run, and therefore that running becomes the offense. Is that understanding correct?
Yeah, and if you don't mind, let me try to clarify a few things. I almost feel like we're actually talking about two slightly separate types of incidents. One is when you mentioned we get phone calls, and like I mentioned earlier, we do sometimes get phone calls from ICE agents or HSI letting us know that they're going to be in our area. Let me preface it with this. They don't tell us exactly where, who they're looking for, and why they're doing it. It's more of a professional notification. It's a way for us to kind of avoid the blue on blue incident where they'll be on our area and then we run into each other, and next thing you know, we're actually, you know, almost, you know, in a gun battle with each other. So in order to deconflict and not have that incident, and it's not just ICE, it's all other agencies. So even if LAPD comes into our area, they'll give us a courtesy call. They'll give us more information. You know, that's slightly different, but any other agency coming into our area, they'll give us a call so that they know that we know that they're in our jurisdiction. With ICE, though, we're only getting general information. They'll tell us, hey, we're going to be in this general area. That's pretty much it. We'll get the information as far as, you know, who's the agent in charge, that type of information, but the specifics of the operation, we don't have. So when you asked about the, you know, can we be out there and, you know, verify the judicial warrant, they're not giving us that information, so we can't verify something we don't have. Second thing is we're also not going out there. We're not going out there on their operation. If something bad happens and maybe there's some type of assault or use of force, maybe there's even a shooting, which has, you know, knock on wood, has not happened in our area yet, then clearly we'll respond, but we're not going with them on their operation. And I hope that kind of clarifies that part of it, because we have never helped them with some type of operation in that sense. The ones that we go on are either ours or sometimes our partner agencies. But when you ask, you know, can we tell people, hey, this is what we got going on? I'll refer back to the incident that happened in LAPD's area. The deputies out there tried to tell people and they just did not believe them, even though they're in uniforms that said sheriff. So sometimes the heat of the situation can kind of, you know, dictate how things are happening. But can we make efforts to do it? 100%, we should make efforts. But I just want to make very clear, though, that when we get these notifications, we're not getting all the information. So we can't verify that.
Take Cynthia's question next. Ari, is your question concluded then? Hi, Ari,
Sorry.
is your question concluded?
Yeah. So my second question is, sorry. My second question is, okay, so now that folks are like, oh, we need to get our paperwork done to apply for the, you know, the permits and all that, you know, the immigration paperwork done. And sometimes for people, it requires getting a history of the fact that they were a victim. So you have to get a police report. You mentioned doing, I think you said 2,400 U visas application documents. So those people need to have their police report to show, you know, the immigration authorities that this happened and verify all that. So what I understand is that LAPD, since the beginning of the Trump administration, now refers those questions to ICE rather than just giving them the report. Is that true as a policy? Although the website says otherwise.
The city of Los Angeles and all the departments within the city of Los Angeles, specifically the LAPD, does not share information with ICE. Those are just things that people put out there, false anti-law enforcement that just try to stymie the trust that we're trying to create with the community. We don't give that information to anybody.
Yeah, let me just also reiterate that on behalf of the Sheriff's Department. Yeah, I don't know where that information came from, but yeah, we don't do that either. We just simply verify the victim's information, that we're giving them a report with their information, you know, not to just some random person, but we're not giving it to anyone else. And like the deputy chief mentioned, we also do the same thing with U visas. So that process has been in place for, you know, a very long time, and there's no communication with ICE on those types of situations.
Yeah, and also remember in 2018, SB 54 made sure that all law enforcement in the state of California do the exact same thing. So what we're doing in LAPD and what the sheriffs are doing is pretty much every other law enforcement agency in the state of California because of SB 54.
Yeah, I appreciate your answer, and I believe that that is what you understand and is policy. But especially if you're going to be in charge of the immigration policies for the agency, that you should double check the front line on that, because who I heard this from was a reliable source. So,
Yeah, and
let
if
me
you
know.
have more information on that, please, again, my Deputy Chief Hurtado, work LAPD, I would love to get more information on that and look into it. If something's being done that's improper, illegal, or against our policies, then we would love to know, and we'll correct it.
Thank you so much.
Thank you, Ari. I'm going to invite Cynthia to ask her question, and then we'll go to Monica and then to Pam. Cynthia.
Hi, thank you. Can you hear me?
Yes.
We can hear you fine,
Thank
Cynthia.
you. Hi, I'm Cynthia. I'm an organizer with Eastside Leads and also a constituent from Boyle Heights. My question is around wanting to know if there's a public-facing list online about the different watch commanders and stations. Oftentimes, when we are supporting tenants that are going through a crisis and they need to ensure that they have a police report or something of that kind, we're often redirected to the watch commander, but we don't have that information, and it's really hard to obtain that information. And this has happened in multiple departments in LA, and I would like to know if there is a list online. How can we make this more accessible for the public to have in order to have some sort of resolutions? Thank you.
If you go to lapdonline.org, all that information for you is there, and that's also where we have the different frequently asked questions and the number to your station. Your station would be Hollenbeck Division, and you can always it's also open pretty much 24 hours a day, so you can access that. We also have, if you go to LAPD online, we have what's called the core system, where you can fill out your own report and get a receipt immediately if it falls into the criteria.
Yeah, so we have similar things in place. I'm not sure if I'm understanding the question completely, but for us, you can call the station at any time, 24/7, and just simply ask for the watch commander, and they'll connect you. To have a list online is a little bit difficult. There's a couple of challenges with that. Like everywhere else, there's a staffing shortage. So who actually is going to be on duty can be questionable because we're constantly trying to fill in. So the names are changing all the time, and we're constantly trying to find people, to fill those vacant spots. So to list who's going to be working at what time, that probably won't happen, but absolutely anytime you call the station and ask for the watch commander, you're going to get the watch commander.
Yeah, exact same thing for LAPD. Thank you, Captain.
Okay, so we'll move on to our next question from Monica.
Hi, so specifically for LAPD, from what I'm hearing is that you guys get information, even general information of where ICE is going to be. So one thing that I would urge you to do is that when you get that information, and you talked about how you were trying to tell people about a situation or that ICE was going to be there or these fake kidnappers or whatever, why not provide that information to us, to the community, so that we can tell people, hey, they're going to be in the area, don't go out or whatever. Because right now what we're doing is we're patrolling the community. We're constantly out there like looking for people that are coming in to kidnap people. So why not have that, faith and to try to really build community, right? Also, I would like to get your contact information so that I can have better understanding and then work with what are the things that we're seeing that make it so that because I know what you're saying, but I don't believe it, right? And I'm very supportive of LAPD. I used to work really close with Deputy Chief Arcos, and but I will call things out when I need to. So if you're getting this information, especially like what happened at MacArthur Park, that was insane. We heard about it because the people that were on the street, right? Not from LAPD, not from them. And then obviously everything's on social media. But if you're getting this information, even a general information, let us know so that we know in our communities, like, hey, especially the people that are patrolling the areas, that, and I understand LAPD can't be everywhere, right? But these are some things that you could do so that we can trust you guys. And I know, like, you look like us, and I just don't understand it. And then, this is a sanctuary city, right? What, I just don't see what you're doing, and not you particularly, but what is happening. Like, you're right, we don't trust you guys because of how we're seeing that we're being treated. We're seeing people being dragged, and you talk about warrant, and then you talk about, they're just going and getting the frutero and the day laborer and stuff like that. That is horrible. You don't have a warrant for the people. They're just going and taking people. They've taken citizens, children at schools at graduations. So do something, like, let us know so that we can protect our community, because I really feel that you're not doing that for us. And I know that there's really good police officers that want to help, that don't want to be part of it. So just be really our friend. Be really there to protect and serve us. Thank you.
I'll try to break that down into some of the questions that are heard within your statement. And thank you for saying that. And trust me, I understand your frustration. Both my parents are from Mexico. They came here in the 70s to work at the garment factory. And, eventually did get their paperwork through President Reagan under the amnesty, I forgot exactly, I think it was called amnesty. They did get their paperwork, but so I understand your frustration, but also when we get information that, let's say, ICE is going to be in the area, sometimes for example, HSI is the only agency that can do intercontinental crimes, arrests for crimes that happened in other countries. The last time they were in Los Angeles, they were arresting a gentleman who was bringing over young girls for the purpose of sexual exploitation up to the age of 12. So when they're here to arrest that person, the last thing we're going to do is tell that person, hey, you might want to get out of here because they're here to arrest you. So we actually don't know why they're there, and it would be considered against the law. It's obstruction of justice if we tell people that there's another agency coming to your area. We're not going to tell citizens of Los Angeles that the sheriffs are going to go arrest them, and I hope then they wouldn't do that to us. It's obstruction of justice.
I'm sorry, I'm not talking about, I'm
okay.
sorry, but I'm not talking about criminals.
But
I'm
let
talking
me,
about regular folks.
if you can let me finish, maybe, because I lost my train of thought now. But okay, go ahead and ask your question.
No, I just wanted to cut you off because I think I'm not talking about the criminals, about the sex traffickers. I'm like, hey, go get them. Freaking, we have a president that's done this stuff, right? But
you're talking about if they're just driving around?
Yeah. I'm talking about them driving around.
Well, we don't even know when they're doing that too. So how could we even do that?
But you just said that they let you guys know when you just said that they provide you information when they're in the area.
Sometimes they do. And when we do know, we can't share that information with you because that would be obstruction of justice. They unfortunately, and I know people don't like to hear this, but they do have the right to operate within the country. And we cannot do anything about it. I can't do anything about it. The captain can't do anything about it. They have the right to be there. We cannot tell them to leave.
But it sounds like you're also suggesting that it's not permissible for you to notify the community that the presence is a legal presence.
Correct. They are a law enforcement agency. And also you have to understand is that there are people, if we do, let's say we do notify somebody, right, which would be illegal, and then there's some sort of action against them and somebody gets hurt, we'd be liable. We just don't do that. I'm sorry.
Yeah, but I think that the clarification that you're not allowed to validate that this presence is a legal presence, but if someone called your offices and asked specifically, this is happening in my neighborhood, could you validate that is a legal presence, or could you come and check it again?
No, if somebody
need to know
if Yeah, if anybody ever has any doubt of who is in that area and they see that, please call us and we'll go validate it. Absolutely, that we can do that. Once it's validated, then we'll step away if it's for civil immigration. Does that make sense? Yeah.
It sounds like that's the layers.
Well, that's a very difficult layer, right?
Yeah.
And that's exactly why we're here trying to answer the questions. And I'll be honest, there's probably going to be incidents where we probably don't know exactly what we're going to do. It's just become so complex. In my 27 years of law enforcement, I've seen things that I haven't seen before. We didn't know about the MacArthur Park incident. I've never seen BBP out there and horses. But again, there's nothing we can do about that.
Are your departments informed about people that are arrested and incarcerated? There was a
Nope.
question about identifying those who have been incarcerated and helping track people down.
Yeah, I think I know the sheriff's department has a list of everybody that's been arrested by local law enforcement, and I believe that DHS also has one. I did see it before. I'm not sure if it's under DHS or HSI or ICE, but everybody has a list of people that arrest. Once somebody's arrested, it becomes public information. So usually that's posted, but they have to be booked. We are not told. Nobody calls me and tells me, hey, we arrested 5 people for civil immigration. We don't know anything about that.
And do you have a sense of the window between being detained and being booked? So
I
that
have
become public?
no idea.
'Cause that could be a delay, I assume.
The Los Angeles Police Department, the state of California, well, actually, it's a California state law. We should or try to book within 6 hours. I don't know what the federal, but the penal code itself is hard enough. I don't know what the federal codes are.
Yeah, if I could just clarify on some on that, and they're not booking them at local facilities. They're taking them to federal facilities. So we, especially us, because obviously we have the county jails, we're not going to have that information because they're not coming to our jails to book these people, unless it happens to be some other type of warrant, but it's not going to come to our jails. So we aren't going to have that information. And I wanted to clarify, even though the previous question wasn't for us, the Sheriff's Department, it was for LAPD. I want to clarify something I said earlier about when we got that call that they're going to be in a general area. That's not the general area of, hey, we're just going to be roaming around. They're doing specific warrants. They're just not telling us the exact place that they're going to and the exact person they're looking for. We've never gotten the call of, hey, we're going to be at, at this place, you name it, a Home Depot, and we're just going to be driving around. That has never happened. So hopefully that helps you understand that we're not getting that information. Because earlier in the year, we used to get a little bit more information from them about their specific warrants. That has kind of diminished over time. Obviously, there's a lot of mistrust across the board everywhere. But the only information that we're getting is just the general idea of where they're going to be, so that if they do serve their warrant, their operation, that we're not going to end up having a blue on blue type of situation. So I hope that clarifies. At least I know it wasn't for us, but it's not, hey, we're going to be in this area just roaming around. That call never comes in.
Yeah. And the question for Monica, and thank you, Captain, for clearing that up. It also sparked something. We've seen some incidents on the television, right? We saw the MacArthur Park incident with the horses. We saw the incident on Main Street at the garment factory. Those we have no clues. We had no clue that they were doing that. And again, only if they're at a specific address for a specific criminal serving a criminal warrant, sometimes they do tell us, but that's only for us to avoid the area, to avoid a blue on blue, so we don't have any tragedy within our agencies.
So it sounds like they would most likely coordinate with you with a true warrant as opposed to an engagement where they're trying to just, assess the situation.
The Home Depot stuff, the MacArthur Park, we had no idea. I saw it on the news, and I was actually looking at it, and I was, well, what park is that? And I was like, oh, it's MacArthur Park. It's our park. I was just as surprised.
Yeah, it was pretty shocking to all of us. So I've got one question in the chat from Cynthia, then we'll go to Heidi's question, and I think that will bring us towards the end of our segment. Cynthia's asking about bounty hunters. What is your kind of knowledge and experience with bounty hunters on this particular issue, and how do you approach that?
All right, so I'll say this. I've heard that. I don't want to call it a rumor, but I don't know another name to put on it. I've never heard anything to verify that. Every person that I've talked to, we have reached out to some people who are willing to talk to us from federal agencies, and I get it. People aren't going to believe everything they say, and I'm not telling you to believe it, but from what they've told us is that that's simply not happening. But I can't tell you what they're doing when I don't work for them. But the information I got is that that's simply not happening.
And with LAPD, we haven't seen it. And we have great communication with all the other captains of 21 geographical locations within the city of Los Angeles, and nobody has ever confirmed that there's bounty hunters or has any information that it truly happened. Well, again, just like the captain said, all we've heard is rumors, just like everybody else. Never seen it.
And then we have a question from Heidi. Please ask your question, Heidi.
Hi, good morning. Thank you for being here. My name is Heidi Gonzalez, and I work for State House LA with through East Side Leads. And I'm going back to the tenant situation and law enforcement. I personally went through something where my landlord threatened me to kill me. And I call LAPD. This happened in Koreatown. And instead of helping me, the officer threatened me to take my baby away if I didn't go away. So and then I had another experience with sheriff's department, working for State House LA as a community organizer, where I tried to get in contact with the watch commander in East LA, and it was impossible. I had to go 5 times, and they were giving me appointments, but it happened not for the watch commander not to be there. So what will be, if you know, what will be the best way to get police reports and make the landlords accountable? Because most of the time, law enforcement refuses to make police reports. And they're very helpful when tenants are in court. But unfortunately, we're not getting them. And I know, because I have heard this before, oh yes, you just have to go and escalate it to the next, boss or something. But that's not the reality that we are facing.
Yeah, and it's very difficult because let's say, he threatened to kill you. If you look at, I mean, I'm not going to get into the specifics of the necessity or the elements of a crime, but it has to be immediate and equivocal. And the person has to have the means to do it immediately. So just because somebody says it, that doesn't mean that it's arrestable or it's actually a crime. And again, it's one of those things that people that are almost unenforceable because we do have the First Amendment right of freedom of speech. It just depends on how it's said and when it's said, and I would have to revert that to the officers that were actually there. As far as if you being not satisfied with the level of service, you can always call the watch commander, and if that doesn't work, you can always reach out to internal affairs and you can report that conduct, or you can say that you're not satisfied with the level of service, and we'll look into it. Sometimes it's a matter of explanation, or sometimes it's just a matter that the officers were incorrect. We're not going to say that we don't have room for improvement. We can always improve. And if anybody believes that there's something that can be improved upon, we'd really appreciate it for bringing that forward so we could properly train the officers for the next time.
Yeah, so real quick, I know you had an issue with our station. I'm sorry, I'll go really fast on this. I'm not sure what you mean when you're trying to make an appointment. You don't need an appointment to talk to our watch commander. I will say sometimes you have to be patient because you have to remember, for at least for our station, that watch commander is overseeing 3 contract cities, which is Cudahy, Maywood, and Commerce, and also the unincorporated East LA area, which is massive. It's over 120,000 people. So there's a lot going on all the time. So sometimes that person, the watch commander's attention will be diverted to emergent situations, but you don't need an appointment. You can simply ask to speak to the watch commander. And as soon as that person is available, they will come out and talk to you. And if that's not happening, like the deputy chief mentioned, there are other ways of lodging complaints, but I think realistically, we just need you to be able to talk to a physical person who can help you resolve whatever issue that you might have. And again, the appointment, I'm not 100% sure where you're going, what you mean by that, but there's no necessity for an appointment. It's simply a request.
Yeah, it was not requested for me to make an appointment, but what I'm saying is almost impossible to get in touch or with the watch commander, and the officers, most of the time, they denied to make a police report, which I thought if someone is requesting it, isn't that you're like, we kind of have the right to ask for a police report, because it's being denied. Most of the time, it's denied.
Okay, so without knowing the specifics behind each incident, I wouldn't say that you have the right to report whenever you want, because again, if the elements of a crime aren't met, and I'm not saying there wasn't, what I'm saying is if they're not, then we're not going to document a report when we don't have those elements. That being said, that's why you need to have a conversation with even the watch sergeant or a field sergeant. It concerns me when you're saying that it's impossible to talk to the watch commander, because I'm at the station a lot, and our watch commanders are talking to people nonstop. I know it because there's typically a log that we have. Not to mention the reports, the not taking reports. To say that we're taking hundreds, if not thousands per week, is probably an understatement. So maybe there's just a disconnect somewhere, but I do want that to be resolved. So if you have those issues, then by all means contact us at the station and we'll try to get to the bottom of it, because I don't want that to be the experience that you have from our station.
Heidi, may I ask for clarification? Are you trying to conduct this this meeting with the watch commander and the filing of the report over the phone, or are you doing it in person?
With the sheriff's department, I was doing it in person.
In person. Okay. So
Yes.
I think that would seem to meet the threshold of what you're describing you
Yeah.
expect. So maybe we're not having the experience that you would expect, Heidi. Is your question concluded, Heidi? Would you like to continue?
No, I think it's always the same thing. There's no clear answers, and there's no it's never easy for us as attendants to get a police report done.
Yes, thank you. So I'm going to let Anabel from Supervisor Solis' office have a few minutes.
I really want to thank Chief Hurtado and Captain Kusayanagi for coming today and being open to all these questions. And I want to thank all the community members for bringing those questions. And I know it's a topic that requires a lot of vulnerability. So I really appreciate that. And I just want to let you all know, sorry, let me put this on, that at Supervisor Solis' office, we're constantly trying to address these issues as they're coming up. Like Chief Hurtado said, this is a time where things are constantly changing, and it's really hard to keep track of everything, but we do try our best. Like, for example, earlier on Tuesday, the board passed a motion with which the supervisor co-authored that is asking county council to look at creating an ordinance where it will be mandated for any law enforcement in unincorporated areas to display their names and to not wear masks. So that's something that passed this week. And we have been looking about how to assist folks through cash aid who need it because they've been affected economically because of the ICE rates. We have also looked at trying to expand different services and ensure that people are still getting them through different routes. So just wanted to make sure that folks are aware of that. And if you're ever having any issues in terms of if you're in our district, District 1, you can also always reach out to our office, and we can act as a liaison to the departments. We do have case workers, so that's their job, is to help out our constituents. So anytime you have any question or you keep trying to get access to any department, any kind of service, just email us, and we'll assign a caseworker and try to help you find a solution or connect you to the right person. I think it is as an attorney, I know that people hate it when you're like, it depends, but it really sometimes is a fact-based situation. So it's really difficult sometimes in settings like this to be able to get a clear answer because we can't share those details. And then I also wanted to add that for the LAPD and for the Sheriff's Department, if you also don't feel comfortable going to the stations, or you feel like you had a few times that you tried, they each also have, like I believe Chief Hurtado mentioned, inspector's office, I believe, and the LAPD commissioner board, and the county has a civilian oversight commission. So those are also bodies that you can go to and file complaints, and they'll help to also investigate to get information from you. So if you want to know about policies, that's what a lot of what the Civilian Oversight Commission is, that they review the sheriff's policies and report back to the community. So there's also another space where you can go and try to get answers. So just want to make sure that that's out there. And like I said, just feel free to also reach out to our office if you ever have any questions, if you're in our district. If you're not in our district, we'll be happy to connect you to the right office as well.
Yes, thank you. I was going to say that exact thing. You are the Justice Deputy for Supervisor Solis, but every supervisor has a Justice Deputy. I imagine that you work closely with your other colleagues.
for example, you're in LA City, here, Boyle Heights. This area is technically LA City, right? But it's still part of the county district as well. So you can always also feel free to reach out to us. But like I said, even if you're not in our district, we'll connect you to the right office.
Perfect. Thank you so much, Anabel. Well, we have a lot of comments in the chat, and believe me that we will be going through them all and sharing them back with our speakers today. I do want to thank our speakers from the Sheriff's Department, from LAPD, and of course from Supervisor Solis's office. This was obviously a topic of great interest, great passion for the members of the Health Innovation Community Partnership. And we have an open request/invitation from Pam to please have this as more of a standing segment. We would love to invite you to come back. We would love the opportunity to continue the dialogue and continue to build that trust in the community and the resource list for our community to really find their ways to collaborate with law enforcement to protect community residents of Los Angeles. With that, we're going to have one final speaker. Rosa Soto is going to talk a little bit about some of the board actions of this week.
Thank you, Heather, and thank you to all the speakers who were here today. I just want to take a minute to say thank you to each and every one of you that came out for the motion regarding the master plan of our general hospital and Centennial Partners. We are excited that there was a unanimous vote on Tuesday for the continued progress of our Healthy Village here on the campus of LA General Medical Center. And the opportunity, I think that we have, I'm gonna use this one. Yeah. The opportunity that we have with this is the community engagement is after all of these years of asking for what we need in our community benefits, we now get an opportunity to come and speak to the developers directly about all of what aligns to community priorities and how we want a community benefits agreement to reflect that. So congratulations to everyone who participated. I think we have a little picture that we can share with everyone. Supervisor Solis extended her very warm thank you to everyone who was there. We had some of our community residents and our leaders there from 8 o'clock in the morning until about 2 or 3 in the afternoon. So again, this is part of the work that was elevated because of the commitment to our space in the Health Innovation Community Partnership. And we appreciate Supervisor's vision since 2017 to have community voice heard. But also each and every one of you, because if it wasn't for your connection, for your engagement, for your continued leadership, right, we wouldn't be here today. So thank you, everyone. And please give yourselves a huge round of applause. And again, just to hear that there's an incredible thank you from all of us at HICP leadership, but also specifically our Supervisor Solis. So this postcard will be posted, and those of you who attended will be getting one. So make sure that you let us know if you were there. And we look forward to hearing more about Centennial Partners at the next meeting. But congratulations, everyone.
Yes, it was a very historic moment. The master plan is going forward for this campus. So we're so excited to kick off that conversation with you. Much more to come in the years ahead. But we are delighted that this campus is getting a historic investment. And that is really due so much to the community efforts from the Health Innovation Community Partnership and all of our community partners in the area that have advocated so tirelessly to ensure the legacy of this campus continues forward to serve this incredible community. With that, we conclude today's Health Innovation Community Partnership meeting. We invite you to join us at the next meeting, which will be on Friday, September 5th. And as mentioned earlier, all of the materials and recordings will be available on our website in about a week's time. Have a wonderful rest of your day and a great weekend. Thank you.